Tell me a little bit about your work as a medical missionary in Africa, and I'm wondering how did that shape your career in infectious diseases?
Well, that's a great question, John. In terms of the basic uh, uh, dates, I was in Kenya, in a little hospital called Kijabe from 1999 through 2003, and then 2006 through 2009,
Hmm.
a total of about 7 years. Really, that time was very, very formative. When I first came to Kenya, I was spending pretty much all my time in the hospital taking care of very sick people. Most of them had conditions that were preventable, or if they had been caught early, they could have been much less severe, and really just wore out, realizing that what I was doing was helping a lot of individuals, but it was kind of a drop in the bucket, and a desire to move upstream and prevent some things. Especially we were talking about HIV, preventing mother-to-child transmission of HIV. We started one of the first programs in the country to do that. And so I was kind of getting into the public health aspect of things, looking at systems, looking at prevention. So when I came back to the US the first time in 2002, I went into private practice here in Little Rock as an infectious disease specialist, but was still consulting on some of the work in Kenya. I realized that was really where my passion was. I had the opportunity to come over to the Arkansas Department of Health in 2004 as medical director for infectious diseases. And then I really, my public health career really sort of was launched at that point.
In 2014, you signed off on the state's influenza pandemic response plan. How close were you involved in that project, and what were some of the major accomplishments from that plan over previous plans?
Well, we had been pandemic planning really since before I came to the health department the first time in 2004. So I've been involved in those plans for a number of years. I think our experience in 2009 with H1N1, was informative, but of course that wasn't nearly as severe as everyone was fearing. So we've been continually revising our plans, and the plan is important, but it's really the planning process that's even more important, because that's when the relationships are developed, when the problem solving, when we get the practice in problem solving, and just learning how to ask the right questions.
And how has that last plan that you guys did, how has that shaped your response to what's currently going on with regards to the coronavirus?
Well, I think there's a lot of things in that plan that we can use. First of all, pandemic planning, what we had in mind was pandemic influenza, which is also respiratory, which is also spreads easily among communities and moves around the globe in sort of an orderly fashion, something that we wouldn't initially have a vaccine for. So all these things, all these assumptions for that plan really fit with our scenario here. At some point we're going to need excess bed capacity, staffing, ventilators, personal protective equipment, all these things. Now some loops that were thrown at us with the COVID-19 are significant. First of all, the speed in which it is spread is faster than I think even our most aggressive exercises and models. Influenza is unique in that it's a virus that spreads around the world every year, but it takes about a year to do that. First it does the northern hemisphere, then it does the southern hemisphere. This one started with the first known case December 1st in Wuhan, China, and before the end of March, it's already in essentially every country on earth. The second thing that we didn't plan very well for was the availability of a diagnostic test that mostly wasn't assumed would be available within the first 3 months of response. It's great to have a diagnostic test, and we need it, but that wasn't a big part of our pandemic plan. And so those are some twists. You make your plan and then you have to adapt it. What I wish is that we were more on the same page in terms of how we need to respond to this in terms of our personal actions. There are some folks who are already, kind of flying into a panic and off the rails, and there are others who just don't seem to have gotten the memo. And we all do need to do social distancing. We need to reduce unnecessary trips. And there are times when I think everyone's kind of gotten the message, and then I'll hear about some big event that's planned, just as if, it was business as usual, or something else where clearly people haven't gotten the picture. If we could all be moving more in the same direction, taking this seriously, taking personal responsibility, but also collective action, and moving towards reducing transmission and also preparing for a lot of sick people. We all have learned a lot from what happened in Washington State because they were the first one. We're also learning lessons from New York, where it's most explosive. A lot of the things that we are doing, I've already done here in Arkansas, were not things that had ever really been done before, like closing all the schools in a state. No one had ever done that before, to my knowledge. Basically closing the bars and restaurants to dine-in options. Some of the states have been more aggressive with so-called lockdown or shelter in place. These are things that have never really been tried. We don't really know whether they work or when they work or in what settings they work best. So these are all things that we're learning from one another. We're next door to Louisiana, and they've done some things differently than we are, but their state health officer is really bright, young guy, and we talk. I share with him my experience, and he shares with me his ideas, and so there's a lot of cross-fertilization.
Thank you. Anything else?
I think that's it.
I appreciate it. Thank you, Doctor.
Yeah, take care. Bye-bye.